Hello everyone, today I'm going to talk about restless leg. Some people may complain that the leg is very uncomfortable and have to move all the time, especially at night, and getting better when walking around or some movement. So that usually means that you may have restless leg. So what caused that? We need to check whether you have iron deficiency because iron play a very important role in the brain. Some people, they already put on some medication for restless leg without checking the iron. They may feel they need the medicine more and more. Usually we have to check iron first. If iron is low, then we can replace with iron supplement, and the restless leg symptom will be gone. That's very simple to fix, just to fix the iron. And what caused the iron deficiency? Is that because of the colon had tumor in that? And we need a colonoscopy to make sure that colon does not have a tumor in there. Also, like females, they may have a heavy period and they lost a lot of blood from period, then that causes anemia and iron deficiency. Patient with iron deficiency, we need to replace iron first. We check the ferritin level. If it's less than 75 nanogram per milliliter, then we need to give the oral iron supplement. Or with the transferrin saturation less than 20%, we will also give iron supplement. If the iron level, serum ferritin level is above 75, the oral supplement may not be enough. You may need IV iron if you still have restless leg. Before, the doctors, they may prescribe you some medicine called pramipexole, ropinirole, and this is not recommended anymore because these medicine with dopamine agonist may actually cause more problem. Dopamine agonists can cause you have augmentation. What that means by augmentation, that means that you take some medicine, like say pramipexole, you find it that you need the medicine more and more. You feel like the medication dose is not enough for you. You may feel worse, and you may get addicted to it. And the symptom will come earlier if your restless leg symptom started at night around 10 p.m. before you go to bed. The onset moves to earlier time, like maybe 8 p.m. you may feel restless leg. Or the restless leg symptom also happen to your arms. If you have augmentation, that the onset of the symptom becoming earlier, or the symptom move to other part, then we recommend you stop the medicine and try something else, like gabapentin or pregabalin. It's very difficult to wean off the pramipexole if you have been on it for a long time already. Then you need to talk with your doctor. They may need to add you a medicine called oxycodone or methadone that is a kind of opiate medicine that help you to wean off the pramipexole. I have seen one patient that he had been on pramipexole for a very long time and on very high dose. So for him, it's very difficult to wean off. And you need to do very slowly. It may take about a couple years to wean off the dopamine agonist. So just be cautious. We need to make sure the doses of dopamine agonist is within the recommended dose. So for restless legs, the most important thing is to check iron to see if you have any iron deficiency. And then think about what caused the iron deficiency. Make sure you get enough iron, and we can add on gabapentin or pregabalin to help with the symptom. Try to avoid dopamine agonist like pramipexole, ropinirole, and dopamine. And for the kids, Some kids may say they feel uncomfortable with the legs and want to move a lot during the night. They describe their own way. They may feel, oh, the legs, it's kind of like itchy and you want to move all the time. So if the kids move a lot at night and which bother him sleep, then you may also need to check iron. So for the kids, if the iron ferritin level is less than 50 nanogram per milliliters, then we will need to replace with iron as well. Sum up, for restless leg, it's very, very important to check iron.